Welcome back to the Morning Blend. And when you talk about signs of aging, this is one of them. These cherry spots, as they're called, seem to develop out of nowhere. And our next guest says they are primarily cosmetic, but the solution is very simple.
That's right. Dr. Deborah Manjoney is here from the Wisconsin Vein Center and MediSpa with more. Good to see you.
Good morning. Great to see you. Thanks.
Yeah, these cherry spots, are they something genetic? Because I feel like as a very pale person, I've had a lot of them.
Yes, they can be genetic. Certainly there's more of a tendency for people to get them if there's a family history. Women can get them after pregnancy or during pregnancy, so it can be even when you're young that you get these, but it's also something that you just see more of when you age.
What are they?
They're just little blood vessels that coalesce together, and they're just more than on the surface of the skin. They're actually bulging out a little bit like a little cherry sitting on the skin. But they're very, very easy to take care of, and that's the nice thing. And people don't realize that we can get rid of them, and it's actually fun for us to do them too, because you know, we see them disappear before our eyes.
That's wonderful. Yeah,
that is nice.
So this is just an example of some being treated. We're using a special laser here, and it's just a couple little flashes that you have to do to each little spot, and they'll turn black and fall off after a few days.
Oh. And then they're gone.
Then they're gone.
That easy. Spider veins on the legs are something that can be really apparent. Cherry spots kind of come out of nowhere.
Right.
But can you do is it the same kind of laser?
Yes, it is. It's the same kind of laser that we use, although we have a number of different kinds of lasers that we use for spider veins. The one we use primarily is the one we just showed for the cherry spots.
Because it looked the same.
Yes.
Yeah.
Yes.
Is that what's called sclerotherapy?
Sclerotherapy is actually when we inject the vein with the medication to get it to go to spasm. And so we treat them in two different ways. First, when you have spider veins, we will treat them with the laser, and then we'll inject them, because we're doing what's called a double injury technique. So we try to injure them from the outside with the laser, then we're injecting the medication into the vein to put it into spasm and to irritate it from the inside. So we think we see them disappearing more quickly by using this double injury technique.
Can they ever be more than cosmetic or of concern?
They can, actually. Spider veins, if somebody has symptoms in their legs, spider veins, especially down around the ankles and the most dependent part of the legs, can be a sign that you've got another larger vein problem, like the saphenous vein being incompetent, reflux, blood going backwards in the legs instead of draining from the legs. So you can develop higher pressure around the ankles.
What about those cherry things too?
The cherry things don't usually mean that you have a different problem or a more serious problem. However, if they're not, you know, some people may think they're cherry spots, but they have those little red dots on the fingertips or on the toes and things like that only. That could be a much more serious problem, and that should be investigated by your doctor.
Good to know.
What about downtime with some of these different lasers, the sclerotherapy? What can people expect?
Well, the sclerotherapy and the laser, during the summer we say, well, with all of these, we usually treat them with we treat them and then we have them wear compression hose. We have people wear compression hose for about 5 days. We say during the summer, if you can do 3 days, we're happy.
Yeah,
you know?
But some of them just look like nylons now.
Yes, they do.
You know?
They do. And especially if you're working and if it's during the week, come in on a Monday or Tuesday, have it done by the weekend, you'll be out of your stockings.
I think they feel good. I've worn them
because
I've had sclerotherapy
They do make your
done.
legs feel good. They absolutely do.
I think they feel great.
I like to wear stuff like that when I fly too, because I know that's a good preventative
Exactly.
thing.
We always recommend that. Please wear compression stockings when you fly, because especially long distances, it's going to prevent you from getting any kind of deep vein clots or any clots forming in your legs.
Good to know. Varicose veins, what is causing a lot of that?
Varicose veins? Well, a lot of it is heredity, but then it's lifestyle issues as well. So if you do a lot of standing during the day, if you have been pregnant more than 2 times, that's something for women to be concerned about, that they could get more varicose veins with that kind of thing. So there are lifestyle issues that bring it on, and usually there is a genetic component that will lead to varicose veins coming. And often in women especially, you don't see a varicose vein on the surface, but you may have a symptom. And so you may have aching legs, you may have leg cramps at night, restlessness, and swelling in your ankles. And those are all things that may make us want to investigate a little bit more using ultrasound.
And it's pretty easy to do that, right? When you come in, even if you just think it's spider, you kind of take a look a little bit deeper and know what is really going on.
And we do a lot of it by symptomatology and where the spiders are located, because there are some typical areas that women get that aren't necessarily related to varicose veins or other underlying vein diseases.
How does your special work then? Because you have a special right now that applies to the cherry spots, as we saw in the beginning, but also to the spider vein treatments.
That's right. For cosmetic spider vein treatments or to treat the cherry hemangiomas, through the month of August, we're offering $100 off for the treatment. So it's usually a treatment that will go for 30 minutes. to do treatment as many as we can in that period of time, and now you'll get $100 off of that price.
That's nice.
That's wonderful.
Yeah. So it's really a very good deal. Obviously, we have a lot more time during the summer because with lasers and things, people don't want to be out in the sun a lot. So it's a great time to come in and have these things done because we have lots of time on the schedule to get you in.
Wonderful. So mention the Morning Blend when you call to have one of those 2 treatments, because right now in this month you can save $100 off of a 30-minute session. That's their special on the cherry spots that we showed you, as well as spider vein treatments. You can call the Wisconsin Vein Center MediSpa 262-746-9088. And we also wanted to mention that you now have your new online store at the MediSpa. It's the marketplace.
Right. It's going to be opening actually in about 2 weeks, and we are very, very excited. We're going to be able to offer our products, and people can even buy treatments and things right online. So we're trying to make it very easy. You can renew your products and all and just buy them online. We're totally excited about getting started with this.
That's
great. So your wimedispa.com website.
That's right.
Wonderful.
Perfect.
Great to see you. Have
Thanks,
a great
Deb.
weekend.
Thank you. Nice to see you.
You too.